How can progress in motivation enhancement be effectively tracked in schizophrenia? Have you ever wondered how we can measure motivation in individuals with schizophrenia? Tracking progress in motivation enhancement is essential for improving treatment outcomes. This involves a mix of clinical assessments, self-reports, and behavioral observations. Let's break it down. First, motivation issues in schizophrenia often relate to negative symptoms. These include a lack of initiative and reduced pleasure in activities, which can greatly affect daily life. Understanding these deficits is the first step in tracking progress. Next, we use various assessment tools. Self-report questionnaires are popular for measuring intrinsic motivation. However, they may not always work well for individuals with cognitive challenges. Tools like the Intrinsic Motivation Inventory and the Motivational Trait Questionnaire can be useful but need careful adaptation. Clinical rating scales are another option. The scale for the assessment of negative symptoms and the negative symptom assessment help evaluate changes in symptoms like apathy and anhedonia over time. These scales relying on clinician observations and patient interviews to gauge severity. Behavioral tasks are emerging as a way to assess motivation-related behaviors. While not as common as self-reports and clinical scales, they offer an objective measure of motivation. Intervention programs play a key role in tracking progress too. Programs like the Motivation and Engagement Training and the Positive Emotions Program for Schizophrenia aim to enhance motivation. They address cognitive, emotional, and behavioral aspects of negative symptoms. Progress is monitored through repeated assessments every 3 months using standardized scales. Improvement in motivation can be seen through reduced scores on negative symptom scales and increased patient engagement. Motivational interviewing techniques are also being studied. These techniques help improve medication adherence and motivation. They focus on building a trusting relationship and using reflective questioning to encourage patients to express their readiness to change. Tracking progress here involves analyzing the interactions between therapist and patient. Noticing increases in patient engagement and decreases in resistance can provide valuable information about motivational shifts. For effective tracking, it is best to combine multiple methods. Use clinician-rated scales, adapted self-reports, and behavioral observations to get a full picture of motivation. Regular assessments help monitor trends over time rather than just isolated changes. Including qualitative analysis of therapy sessions can also help understand motivational mechanisms in action. Adapting tools and interventions to fit the individual's cognitive and emotional profile can improve accuracy. In summary, tracking motivation enhancement in schizophrenia requires a multidimensional approach. By integrating clinical scales, patient self-reports, behavioral observations, and therapeutic interactions, we can effectively monitor progress and adjust treatment strategies.